People are often referred to rheumatology with a lot of uncertainty. They're in pain, they're stiff or exhausted, but they're not always sure why. And many have been told various things like it's wear and tear, or your blood tests are normal so there's nothing to do, or it's just part of getting older. So let me explain clearly what rheumatology actually is. And it's important that when seeing a specialist, everything you've described really matters. Rheumatology is a medical specialty that looks after conditions affecting the joints, the muscles, bones, and the immune system. This also includes inflammatory arthritis, autoimmune conditions, which I manage, connective tissue disease, and disorders where the immune system is driving pain, stiffness, fatigue, and joint swelling. These conditions don't always show up clearly on scans or early blood tests, and people don't always behave in the way other people expect. One of the biggest misconceptions is that joint pain is always mechanical, meaning simply wear and tear. In reality, many autoimmune rheumatic conditions are inflammatory and immune-driven, and they behave very differently. Inflammatory pain is often worse in the morning, associated with stiffness, swelling, or fatigue, and it doesn't always improve at rest. You should then consider a rheumatology assessment. If you're experiencing things like persistent joint pain, particularly when there's joint swelling, if you have morning stiffness lasting half an hour to an hour or more, unexplained tiredness along with pain, symptoms affecting multiple joints and symptoms can come and go, and they can flare up, especially if these symptoms are interfering with your daily life. My job as a rheumatologist is not just to label a condition, it's to understand patterns, assess your inflammation properly, and decide whether these symptoms you're struggling with are mechanical, inflammatory, or autoimmune, or a combination of both. So what I do on my day-to-day basis is we use a combination of detailed history, we examine you, we target your blood tests, and image where appropriate to reach the appropriate diagnosis that's right for you. And it's just important that we create a management plan. In many inflammatory and autoimmune conditions, early diagnosis is the real difference because it allows us to control that inflammation affecting you, reduce pain and stiffness, protect your joints and function, and improve long-term outcomes. Waiting too long can allow unnecessary damage to these joints and prolong symptoms. Now, the question is, what should you expect as a patient? A rheumatology consultation should feel thorough and collaborative. It's about understanding your symptoms, your priorities, and your concerns. It's not just about blood test results. And even when the diagnosis isn't immediately clear, there's value in structured follow-up and monitoring. If you're dealing with ongoing joint pain, stiffness, or tiredness, and you don't yet have clear answers, a rheumatology assessment can provide clarity and direction. Understanding what's driving symptoms is often the first step towards managing them properly.